A 63-year-old man with background history of type 2 diabetes mellitus, hypertension, osteoarthritis, and ischemic heart disease is admitted to the hospital with a right lower lobe pneumonia. On admission, his urea and electrolytes are as follows: sodium 134, potassium 4.2, urea 9.8, creatinine 146. On review of his medical record, his blood 3 months ago was sodium 135, potassium 4.1, urea 4.3, create 88. Which one of the following of this regular medication is it safe to continue? Metformin, low dose aspirin, ramipril, ibuprofen, bendroflumethiazide.
Low dose aspirin.
Low dose aspirin. Right, doctor. Because other there is increase in creatinine, right? Previous creatinine was 88 and now it has increased to 146. So that is more than 30% of the baseline. We read today if there is increase of 30% of the baseline. So it has increased from 30%. So here low dose aspirin is safe. Which one of the following factors would suggest that a patient has established acute tubular necrosis rather than pre-renal uremia? So we today read the chart. Urine sodium 10, fractional urine excretion 20%, increase in urine output following fluid challenge. Specific gravity 1025, fractional sodium excretion 1.5%. So the chart is a bit difficult to remember, but if you keep on writing and discussing with your colleagues, then you will remember, right? So because yeah, no, fractional sodium excretion 1.5%. So he has established acute tubular necrosis rather than pre-renal uremia. The correct answer is fractional sodium excretion 1.5%. A 77-year-old woman on your ward has chronic kidney disease of the following, which is most likely to correct vitamin D deficiency in your patient? Sando K, effervescent potassium, calcium carbonate, phosphate, sandose, effervescent, phosphate, thiamine, and alpha calcidiol.
Phosphate sandose.
Most likely to correct vitamin D deficiency. It's alpha calcidiol, right? We read today, doctor. Right? So it is used as a vitamin D supplement in end-stage renal disease because it does not require activation in the kidneys. So the correct answer is alpha calcidiol. A 29-year-old man has his renal function checked. The EGFR is calculated to be 54. Which one of the following factor is most likely to explain this unexpectedly low result? So we read today there are 3 factors which affect: drinking a large amount of milk, being dehydrated when the blood sample was taken, being very tall, excessive alcohol intake, large muscle mass secondary to bodybuilding.
Alcohol.
Think again, we read it today only. What is affected? Dietary intake, some amputation we read, some muscle building. So the correct answer is large muscle mass secondary to bodybuilding. So it may affect the result, right? Other thing is that if you take a large amount of meat a day before, that can affect. So the correct answer here is large muscle mass secondary to bodybuilding. If the option it was there that patient is amputated, so that may be also the correct answer. Like other things will not affect. Dehydration, large amount of milk, very tall will not affect. Right? Alcohol will also not affect. So why do patients with chronic kidney disease have a raised phosphate level? Because of decreased renal excretion, increased gut absorption, hypervitaminosis D, primary hyperparathyroidism, decreased 25 alpha hydroxylation of vitamin D. Easy. You can try.
Hyperparathyroidism.
It's primary, doctor. CKD patient have secondary. Primary means
Yeah, primary now.
so decreased renal excretion. That's why they have raised phosphate level. No problem. Keep on trying. That's why we gave some phosphate binders, right? A 50-year-old man with dialysis dependent chronic kidney disease is awaiting the renal transplant. He complains of fatigue. On examination, you note heart rate 95 beats per minute, soft ejection systolic murmur that doesn't radiate, and pallor. There were no other abnormal features. What is the most likely cause of his fatigue?
Anemia.
Yes, let's see. Heart failure, endocarditis, uremic encephalopathy, anemia, and hyperkalemia. So this is a gentleman, 50 years and 95 beats per minute. Ejection systolic murmur is there, but that doesn't radiate. And pallor is present, right? So anemia is the correct answer. So he will have that murmur due to anemia. He's pale. Next question is, a 85-year-old gentleman with background of osteoporosis and chronic kidney disease was admitted following a fall at home. He was experiencing significant lower back pain. A lumbar spine X-ray was showing signs of fractured lumbar vertebra. A subsequent MRI lumbosacral spine showed a new L3 bus fracture with no evidence of cord compression. A neurosurgical opinion was obtained who advised conservative management in the form of pain control, physiotherapy, and mobilization as pain allows. Given his background of chronic renal impairment with a creatinine clearance of 21 ml per minute, he was started on a buprenorphine patch. Which one of the following opioids would be safest to use for this breakthrough pain? Because he has compromised renal function. So they are asking which of the medicines given following is renal safe. Ibuprofen is not safe. Pethidine, morphine, diamorphine not safe. So correct answer is oxycodone. Oxycodone is safe because the patient is at end stage renal failure 21 ml per minute. Right?